Have you ever wondered what truly happens when a man's sexual health begins to shift with age? Maybe you've noticed subtle changes, like it taking a bit longer to become fully aroused. Or perhaps you've experienced more pronounced challenges, such as the penis not getting hard at all. If you think this change is a definitive sign that everything is going downhill, I want to reassure you, that's far from the truth. In fact, there's a wealth of knowledge and proven medical interventions and personal strategies available that can make a world of difference. Today, we're going to explore a topic that many shy away from discussing openly, yet it's so essential for maintaining overall well-being and quality of life as we age. We're focusing on those moments when the penis doesn't get hard, a situation that might happen sporadically or could be a recurring concern. Instead of seeing this as a dead end or something to be embarrassed about, I invite you to view it as an opportunity to learn about the many factors that can influence sexual performance and satisfaction. You'll find that there's a lot more nuance here than just it works or it doesn't. What we're about to discuss goes beyond performance in the bedroom. It touches on physical health, emotional well-being, and the quality of our intimate relationships. By understanding the medical, psychological, and relational factors at play, we unlock the ability to make informed choices about our health, strengthen connections with our partners, and boost our self-confidence. After all, sexual health isn't just about a single moment of arousal. It's about living a fulfilling life, nurturing intimacy, and fostering a sense of connection with ourselves and those we love. Before we dive into the heart of the discussion, I have a small favor to ask. If you haven't already, please take a moment to subscribe to our channel. Just hit that subscribe button and tap the notification bell. That way, you'll be the first to know when we upload new content geared toward enhancing health, happiness, and overall well-being in men of all ages. Your support means so much to us and helps us reach others who might also benefit from this information. And if you find this video helpful at any point, don't hesitate to give it a thumbs up. It really does help spread the message to a broader audience. I also encourage you to participate in the conversation by commenting below. If you found value in today's topic, let me know by typing yes. If it didn't quite resonate, simply type no, and feel free to share what you'd prefer to see in future videos. Your feedback is like a roadmap, guiding me to create content that directly addresses your interests and concerns. All right, let's get straight to it. We're going to unpack one of the most crucial subjects for any man over 40, and even younger men can benefit: how to understand, address, and overcome challenges in sexual health as we age. By the end of this discussion, you'll have a clearer perspective on what might be causing erectile difficulties, and you'll also walk away with practical solutions that can positively impact your life for years to come. Sexual health is a cornerstone of overall well-being for men, regardless of how young or old they might be. Far too often, we assume that once we hit 40, 50, or beyond, our best days are behind us. But that assumption overlooks the body's remarkable resilience and the power of knowledge and self-care. The key isn't to ignore the changes that happen with age, but to understand them, adapt, and sometimes even turn them into advantages for deeper intimacy and connection. When we talk about sexual health in mature men, one of the most common topics that comes up is erectile dysfunction, often referred to as ED. According to a widely referenced study, the Massachusetts Male Aging Study, which is also cited by the American Urological Association, approximately 52% of men between the ages of 40 and 70 experience some degree of ED. This is a significant number, and while it might initially feel alarming, it also means you're not alone. Far from it. Knowing that so many men share this experience can be a profound relief, removing much of the stigma that often accompanies ED. However, it's important to recognize that ED is rarely just a performance issue. It's often a window into other underlying health concerns. For instance, high blood pressure can restrict blood flow to the penis, while diabetes can affect nerve function. Hormonal imbalances, particularly a decline in testosterone, can dampen sexual desire and make it harder to perform. In other words, the penis not getting hard can sometimes be an important clue that something else in the body or mind needs attention. Understanding this broader perspective doesn't mean feeling discouraged. On the contrary, it's a chance to catch potential health concerns early and address them in a proactive way. Proper management of conditions like diabetes or heart disease, for example, can help alleviate ED symptoms while also improving overall health. This comprehensive approach transforms ED from a dreaded performance failure into a motivator for better self-care. Finally, remember that we're not just bodies, we're also emotional beings. Stress, depression, anxiety, and relationship issues can all play pivotal roles in sexual health. That's why addressing ED effectively often requires looking at both the physical and psychological dimensions of wellness. If one area is out of balance, let's say chronic stress from work or feeling disconnected in your relationship, it can have a real, measurable impact on sexual performance. Conversely, improved emotional well-being can enhance physical intimacy, creating a positive feedback loop. What happens when the penis doesn't get hard? Erections may look simple on the outside, but behind the scenes, they rely on a finely tuned collaboration between the brain, hormones, nerves, and blood vessels. Think of it as a symphony orchestra. If one section is offbeat or out of tune, the entire performance can falter. Here's a breakdown of what typically happens when everything is running smoothly and what goes awry when you experience ED. 1. Mental arousal begins. A thought, visual cue, or physical touch sends a signal to the brain that says, "Hey, we're interested in sexual activity." The brain then triggers a cascade of hormonal and neural responses that prepare the body for an erection. 2. Hormonal signaling. Chemical messengers, such as nitric oxide, prompt blood vessels in the penis to widen, increasing blood flow. Testosterone and other hormones also rise in response to arousal, fueling libido and sexual desire. 3. Blood vessel dilation. The arteries that supply blood to the penis expand, allowing more blood to enter. Meanwhile, the veins that drain blood out of the penis constrict. This traps blood in the penile tissues, leading to an erection. 4. Nerve coordination. Nerves in the penis and surrounding areas continue sending signals that maintain the erection. If these nerve pathways are damaged, say by diabetes or neurological issues, they can't effectively sustain the erection. When the penis doesn't get hard, it means something within this intricate process has been disrupted. It could be related to blood flow, nerve function, hormone levels, mental health, or even a subtle combination of factors. Recognizing this complexity is vital because it underscores why a quick fix mentality may not work for everyone. Sometimes, simply addressing one factor, like taking a prescription medication, might help temporarily, but long-term success often comes from a multifaceted approach, improving physical health, managing stress, and tuning into emotional well-being. Common causes of ED. Let's look at the primary categories that contribute to ED. You may find that more than one factor applies to your situation, which is why a comprehensive assessment by a healthcare professional is so valuable. 1. Medical issues, or cardiovascular disease. High blood pressure or atherosclerosis, plaque buildup in the arteries, can seriously limit blood flow to the penis. Poor circulation often shows up first during sexual activity because an erection requires a robust blood supply. Diabetes. Both type 1 and type 2 diabetes can affect nerve endings and blood vessels, making it more challenging to maintain an erection. Even borderline or pre-diabetic conditions might contribute to erection difficulties. Neurological conditions. Diseases like multiple sclerosis or Parkinson's can disrupt nerve signals that are essential for erection. Kidney and liver issues. Chronic kidney or liver disease can influence hormone levels and overall energy, thereby affecting sexual function. 2. Hormonal imbalances, low testosterone, low T. After about age 30, testosterone levels may gradually decline. By the time a man reaches his 40s or 50s, levels might drop to the point of affecting libido, stamina, and erectile quality. If you suspect low T, a simple blood test can offer insights, and treatments like testosterone replacement therapy might help. Under medical supervision, of course. Thyroid disorders, hormones produced by the thyroid also play a role in metabolism and sexual function. An overactive or underactive thyroid can indirectly affect erections. Prolactin imbalance. This less common issue can arise from pituitary gland problems influencing sexual desire and function. 3. Psychological factors. Stress. Ongoing stress, whether it's from work, finances, or family, can lead to constant activation of the body's stress response. High levels of cortisol, the stress hormone, can lower testosterone and hinder blood flow. Anxiety, performance anxiety, or anxiety stemming from general life pressures, can derail the mental component of arousal. Once the cycle of anxiety sets in, worrying about whether you'll get or maintain an erection, it can become a self-fulfilling prophecy. Depression, characterized by persistent sadness, low energy, and decreased interest in activities, depression can also dampen libido. Antidepressant medications can sometimes affect erection quality or sexual desire, so discussing side effects with a doctor is crucial. Relationship issues, emotional disconnection, or unresolved conflicts with a partner can manifest physically. Open, empathetic communication is key for reestablishing intimacy. 4 lifestyle choices. Smoking. Tobacco use constricts blood vessels and reduces overall blood flow. It also speeds up arterial plaque buildup, which is a direct enemy of strong erections. Excessive alcohol use. While moderate drinking might help you relax, too much alcohol compromises the body's ability to perform sexually. Chronic heavy drinking can also cause long-term nerve damage, alcoholic neuropathy, and hormonal imbalances. A lack of exercise. Regular physical activity improves cardiovascular health, hormone balance, and stress levels, all of which feed into sexual function. In contrast, a sedentary lifestyle contributes to obesity, high blood pressure, and poor circulation. Poor diet. Diets high in sugary or processed foods can exacerbate conditions like diabetes and obesity, directly affecting erectile quality. By identifying where you stand in these categories, you can begin addressing the root causes rather than merely treating symptoms. For example, if you discover that stress is a major contributor, adopting stress management techniques like mindfulness meditation, regular exercise, or speaking with a therapist could be transformative. If a particular medical condition is at fault, working closely with a healthcare provider to get that condition under control could lead to marked improvements in both erections and overall health. Statistics to consider. When it comes to understanding erectile dysfunction, ED, and its potential causes, data and research can be eye-opening. Rather than guessing or relying on anecdotal evidence, referencing reputable studies gives us concrete insights into what really works and what might not. Here are 2 key findings to keep in mind as we move forward. 1. Regular exercise and ED risk. A 2020 study published in the Journal of Sexual Medicine found that men who exercised regularly, engaging in at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week, reduced their risk of ED by around 30%. This underscores the connection between overall cardiovascular fitness and sexual health. When your heart is strong and your blood vessels are working efficiently, it's much easier to achieve and maintain an erection. Regular exercise also supports healthy hormone levels, helps with weight control, and can reduce stress, all of which feed into a better sexual experience. 2. Prevalence in men in their 40s. According to information from the Cleveland Clinic, nearly 40% of men in their 40s experience ED, and the likelihood of encountering it increases with every decade of life. This statistic is crucial for normalizing the conversation around ED. Many men believe ED is something that only happens to older guys, but in reality, it can begin earlier and sometimes even affects younger men. The good news is that recognizing the prevalence of ED can help reduce the stigma and encourage more men to seek effective solutions without feeling isolated or embarrassed. Finding solutions, medical and lifestyle approaches. If you've noticed difficulties getting or maintaining an erection, it's important to remember one thing above all. ED is a symptom, not the root cause. Simply put, the penis is like the canary in the coal mine, offering signals about your broader health. While it might feel discouraging to confront ED, it's actually a crucial opportunity to uncover and address any underlying issues, ranging from heart health to hormone levels to mental well-being. First step, consult a healthcare professional. Your best starting point is a consultation with a qualified healthcare provider. This could be a primary care physician, a urologist, or even an endocrinologist if hormonal imbalances are suspected. Through a combination of blood tests, a physical exam, and a detailed discussion of your medical history and lifestyle, they can determine whether your ED is linked to a specific medical condition or if psychological factors are playing a key role. Accurate diagnosis is the foundation of any effective treatment plan. Without it, you may find yourself trying multiple treatments with minimal results. For men who need direct medical intervention, there are a variety of options available. Below are 2 common approaches. 1. PDE5 inhibitors. Medications such as Viagra, sildenafil, and Cialis, tadalafil, belong to a class of drugs called phosphodiesterase type 5 PDE5 inhibitors. They work by enhancing blood flow to the penis, making it easier to achieve and sustain an erection when sexually aroused. While PDE5 inhibitors can be highly effective, they are not suitable for everyone, particularly if you take nitrates for heart conditions or have certain other health issues. That's why it's absolutely critical to consult your doctor before starting any of these medications. Common side effects might include headaches, flushing, or mild digestive issues, but many men tolerate PDE5 inhibitors well. 2. Testosterone therapy. If tests reveal low testosterone levels, hormone replacement therapy, HRT, could be an option. Low T not only affects libido and erectile function, but can also contribute to fatigue, loss of muscle mass, and mood changes. For men whose labs confirm significantly lowered levels, testosterone therapy, administered through injections, gels, or patches, may help restore energy, improve sex drive, and enhance erection quality. However, it's not a silver bullet for every case of ED. If other physical or psychological factors are present, you might still need a more comprehensive strategy. Always discuss the benefits, risks, and potential side effects with your healthcare provider. Lifestyle changes. Even if medical interventions are part of your plan, adjusting lifestyle habits is often the cornerstone of long-term success. These choices can make or break your efforts to improve sexual health and overall wellness. 1. Quit smoking. Smoking damages blood vessels over time, restricting circulation and making ED more likely. The chemicals in tobacco also impede the body's ability to deliver adequate oxygen and nutrients to tissues, including the penis. Quitting smoking may not be easy, but it's among the most impactful changes you can make for your sex life and general health. Many people find success through nicotine replacement therapy, prescription medications, or behavioral support programs. 2. Exercise regularly. Physical activity is one of the most effective ways to keep your cardiovascular system in top shape. You don't have to become a marathon runner, but incorporating brisk walking, cycling, swimming, or even strength training a few times a week can dramatically enhance blood flow, reduce stress, and help maintain a healthy body weight. These are all critical factors in preventing and managing ED. Consider partnering with a friend or family member for workouts. Accountability can be a powerful motivator. 3. Healthy diet nutrition plays a central role in heart health, blood pressure management, and hormone balance. Diets rich in fruits, vegetables, whole grains, and lean proteins can support better blood circulation, while diets heavy in processed foods, saturated fats, and sugars can heighten the risk of conditions like obesity, diabetes, and heart disease, each of which can aggravate ED. Think of your meals as fuel for not just your body, but also your sexual vitality. The mind-body connection. One of the most overlooked aspects of ED is how deeply the mind influences the body. Anxiety, stress, depression, and even relationship conflict can all take a toll on sexual performance. Sometimes men fall into a self-perpetuating cycle. 1 or 2 episodes of ED spark anxiety, which then creates pressure to perform, which in turn increases the likelihood of further erectile difficulties. Breaking this cycle often requires directly addressing the psychological factors at play. Performance anxiety. A common trigger for ED, performance anxiety can stem from fear of disappointing a partner, past negative experiences, or general low self-confidence. Talking openly with your partner about these fears can help relieve the burden, and seeking professional counseling may offer tools for managing anxiety. Stress management. Chronic stress, whether it's job-related or personal, keeps the body in a state of heightened alert, increasing cortisol levels and making relaxation and arousal more challenging. Techniques like meditation, deep breathing exercises, or mindfulness can help lower stress and improve overall sexual function. Therapy. Cognitive behavioral therapy, CBT, sex therapy, or couples counseling can be transformative, especially if underlying emotional or relationship issues are causing or contributing to ED. A mental health professional can offer coping strategies, communication techniques, and mindset shifts that pave the way for healthier, more fulfilling intimacy. By combining medical insight with lifestyle adjustments and psychological support, you can significantly improve your sexual health and overall quality of life. Remember, ED often serves as a red flag for broader health or emotional challenges. Addressing it proactively can lead to major benefits beyond the bedroom. Tips for mental resilience. Sometimes we focus so intensely on the physical side of sexual health that we forget just how much our mental state contributes to the overall experience. Feeling anxious, overwhelmed, or emotionally distant can create or worsen issues with performance. Fortunately, there are several strategies you can employ to build mental and emotional resilience, which in turn can have a positive effect on your sexual well-being. 1. Mindfulness practices, or meditation. Taking just a few minutes every day to sit quietly, focus on your breath, and gently acknowledge thoughts as they arise can significantly reduce stress levels. You don't need a fancy setup, just a calm space where you can momentarily disconnect from the noise of everyday life. Over time, you'll likely notice enhanced mental clarity, better emotional regulation, and an easier path to arousal because you're less weighed down by intrusive thoughts. Deep breathing. When anxiety starts creeping in, whether it's related to performance or something else, practicing deep, measured breaths can help keep your body and mind calm. Try inhaling slowly through the nose for a count of 4, holding for a brief second, and then exhaling through the mouth for another count of 4. Repeating this cycle can be both grounding and physically relaxing, helping you feel more centered in the moment. 2. Therapy, or cognitive behavioral therapy, CBT. This form of therapy focuses on identifying and reshaping negative thought patterns that might be fueling performance anxiety or other mental roadblocks. For example, you might be telling yourself, "I'll never overcome this," or "I always fail when it matters most." A CBT practitioner will help you challenge those beliefs, replacing them with more balanced, constructive thoughts. Over time, this can reduce anxiety's grip on your sexual experiences, paving the way for more confident and enjoyable intimacy. Couples therapy. If ED-related stress is affecting your partnership, seeking therapy together can foster improved communication and mutual support. Sometimes, a neutral third party can offer fresh perspectives and tools for handling sensitive conversations. Open communication. Talk openly with your partner. Fear of judgment can create a huge emotional barrier in the bedroom. When you share what you're going through, whether it's anxiety about performance, stress from work, or concerns about aging, you and your partner can work together to alleviate those worries. Honesty not only builds trust, but also promotes emotional intimacy, making sex a collaborative and loving experience instead of a stressful performance test. Set realistic expectations. No one is in a constant state of perfect physical and emotional health. Some days are better than others. Communicating these normal fluctuations can help reduce the pressure both you and your partner might feel, making room for patience and understanding. Strengthening relationships, the role of emotional intimacy. Remember, sexual health isn't solely about the mechanics of getting and maintaining an erection. It's also deeply linked to emotional intimacy and the quality of your relationship. When challenges arise, like ED or low libido, addressing them together can actually reinforce the bond between you and your partner. By facing the issue as a team, you create a space where vulnerability and empathy thrive. Tips for better communication. Honesty. Share your feelings. If you're experiencing anxiety, fear, or frustration around sexual performance, opening up to your partner can bring you closer together. While it might feel uncomfortable at first, being honest typically reduces tension and eliminates the guessing games. You might be surprised how supportive your partner can be when given the opportunity to understand your perspective. Identify triggers. Together, you can figure out what might be triggering ED or other intimacy issues. Is it stress from work, an unresolved argument, fatigue? Pinpointing the source of the challenge can guide you both toward practical solutions. Patience. Allow time for adjustment. Whether you're undergoing medical treatment, making lifestyle changes, or engaging in therapy, progress takes time. Both partners might need to adjust expectations and allow space for trial and error. Being patient with yourself and with each other can ease tension and create a more relaxed environment, which is crucial for rekindling desire and arousal. Celebrate small wins. Did you manage to have a positive, pressure-free, intimate moment? Did you communicate openly about concerns for the first time? These small victories can build momentum and motivation to keep going. Recognizing progress, even when it's incremental, helps maintain a hopeful and encouraging outlook. 3. Explore together. Sensual activities. Sometimes couples feel stuck in routine or performance-oriented intimacy. Consider exploring massages, new forms of touch, or even guided mutual relaxation exercises. These low-pressure, intimate activities can help you both reconnect physically and emotionally. Share fantasies. If you feel comfortable, discussing fantasies or desires you've never shared before can light a spark of excitement. It might be something simple, like trying a new location or changing up the mood with soft lighting, or something more adventurous. The key is that both partners feel safe and enthusiastic about exploring new avenues of pleasure. Redefine intimacy. Intimacy isn't limited to penetrative sex. Close contact, kissing, cuddling, and emotional vulnerability all play massive roles in a fulfilling relationship. Broadening the definition of what counts as intimacy can lessen performance anxiety and increase connection. Conclusion: it's essential to remember that sexual health challenges are extremely common, especially as we grow older or face new life stressors. Yet common doesn't mean permanent. By addressing these issues in a holistic manner, attending to physical, emotional, and relational factors, you can carve a path toward improved confidence, deeper connection, and genuinely fulfilling intimacy. Embrace a multifaceted approach. Your journey might involve consulting a healthcare provider, exploring prescription medications, committing to healthier lifestyle habits, or looking into therapy options. Frequently, a blend of these strategies brings about the best outcomes. Stay engaged. Monitor your progress over time. Adjust your routine, continue open dialogues with your partner, and seek professional guidance if you hit new roadblocks. This proactive approach keeps you moving forward, even if challenges arise. Know you're not alone. Millions of men face these very same issues, and countless success stories demonstrate that with the right support and mindset, transformation is possible. Finally, if you haven't already done so, this is the perfect time to subscribe to our channel and hit the notification bell. By doing so, you'll stay in the loop on all our updates, tips, and in-depth discussions about male health and well-being. If you found this video informative or uplifting in any way, please let us know by giving it a thumbs up, and I'm eager to hear your feedback. If this video resonated with you, type yes in the comments below. If it didn't align with your needs, type no and share your suggestions for improvement. Thank you so much for watching and investing in your own sexual health journey. Remember, you deserve a robust, satisfying, intimate life, and it all starts with making your well-being a priority. I'll see you in the next video, where we'll continue exploring ways to enhance and maintain a healthy, happy lifestyle in every area. Until then, take care of yourself and remember, you have more power than you realize to shape your sexual health and overall quality of life.